ahead and start recording. All right. Good morning. We are going to begin this meeting of the Committee of the Whole of the Wayne County Commission. Madam Clerk, roll call, please.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Anderson. Commissioner Anderson. Commissioner Basham.
Here.
Commissioner Clark Coleman.
Here.
Commissioner Dodd.
Here.
Commissioner Haddis.
Present.
Commissioner Killeen. Commissioner Killeen. Commissioner Kinlock.
Present.
Commissioner Knizik. Commissioner Knizik. Commissioner Marecki.
Here.
Commissioner Baker McCormick.
Here.
Commissioner Scott. Commissioner Scott. Commissioner Varga.
I'm sorry, I was muted. I'm present, Commissioner Scott.
Thank you. Commissioner Varga.
Here.
Vice Chair Pro Tem Baydoun.
Here.
Vice Chair Palomero.
I am wrapped in a flag here in Ingham County, Michigan.
Thank you. Chair Bell.
Here.
Commissioner Anderson. Commissioner Killeen.
Right here.
Thank you. Commissioner Knizik.
He said he'll be a little late.
You have a quorum present.
Thank you so much. Next item, please.
Approval of the minutes from the July 21st, 2021 meeting.
Is there a
moved.
motion? Moved by Commissioner Vice Chair Baydoun. There's support.
Support Kinlock. Clark Coleman. Support.
Supported. Any corrections to the minutes? Hearing none, all in favor say aye.
Aye.
Aye. Anyone oppose? Anyone wish to abstain?
Motion carries.
Thank you. Next item.
Chair's remarks.
No remarks today. Next item.
Unfinished business, there is none listed. We're moving to item E1, discussion with Wayne County Probate Court Chief Judge Freddie G. Burton Jr. and Third Circuit Court Chief Judge Timothy M. Kinney on Wayne County Jail and recidivism data analysis.
Okay, thank you so much. So I thought it was very important that we come and update the entire commission on the great work that the judges and so many members of our community have been doing. As you may remember, in 2015, this Wayne County Commission unanimously voted for the Stepping Up Resolution, which is a resolution to figure out how we can divert people from jail who have mental illness or may have substance abuse issues. We realized that a lot of the work was being done, but it was being done in silos. I'm so happy that Judge Burton and Judge Kinney got together and brought in all of our countywide stakeholders, from the Mental Health Authority, from the jail with Chief Dunlap, to Wayne State University, to the prosecutor's office, different police chiefs around the county. We've been meeting for over 2 years, and this is some of the work that we've done. There is an exemplary model in Miami-Dade County. We were able to go down there to see how they operate their program. They came up here to Detroit and Wayne County to see what we're doing. So it's been great collaboration between Miami-Dade and Wayne County to get a handle on this, because as you know, unfortunately, across the country, jails unfortunately become the mental institution for so many of our residents when they need to be in treatment. So we have been doing great work, and I'm so happy to have Judge Burton and Judge Kinney here, just at a high level, talk about some of the things we've been able to accomplish. So at this time, I will turn it over to whoever wants to go first. Judge Kinney or Judge Burton?
Thank you, Madam Chair and members of the commission. It's a pleasure to be before you. In fact, I'll see you tomorrow too for budget hearings, but it's a pleasure always to see all of you. I wish you well. Hope everything is going well for you. We have a presentation that we want to share with you this morning and be happy to answer any questions that you might have. We're going to start with our project coordinator, Nancy Hambrick, and she's going to be followed by Tyler Logan. Then I will have an opportunity to say a few words, and Judge Kenny. We always bring the real strong one at the end. Judge Kenny will come in as our fourth presentation. And so, Nancy, if you're on the line, I don't know who's handling the presentation slide. There it is. And so I will turn it over to Nancy Hambrick.
Hi, good morning, everyone. And Chair Bell, thank you so much for letting us be here today. Real quick, we just wanted to give you a little bit of background. I am the project manager that's working with Wayne County from the Center for Behavioral Health and Justice at Wayne State. And I don't know if many of you are familiar with us, but we are working in 26 counties across the state of Michigan. And we work with specifically with counties like Wayne that have signed the Stepping Up resolution and are interested in reducing the jail population, specifically around people with behavioral health and mental illness challenges. So Wayne County is unique in that we have been invited in to facilitate these changes instead of just provide data around them. So what you're going to see today and hear about from the judges is really unlike anything else going on in Michigan. And it's really, it is the result of all of the hard work and effort from multiple different organizations. And I'm going to have Tyler kind of walk you through the timeline of how we've, what's been going on in Wayne County. Thank you.
Thank you, Nancy.
And next slide, whoever is controlling that. Thank you. Hi, everyone. My name is Tyler Logan. I'm a project coordinator with the CBHJ. Chairwoman Bell kind of walked us through some of the background of how we got started, but I want to expand a little bit on the story and the timeline from how we got to point A to point B, and currently where we are now. So contextualizing the Wayne County sequential intercept model mapping timeline, in 2015, Chairwoman Alicia Bell, along with the hard work of you all in the commission, championed the Stepping Up resolution. This was a real big moment for Wayne County as a call to action was made to now address the behavioral health needs for individuals across the entire county. Not only did Chair Bell initiate this at the time with you all, but she also has represented the commission on the executive committee that has really been pivotal in deciding a lot of moments that the project had as it began and as it wrapped up. Moving forward, in the spring of 2018, leadership, thank you. In the spring of 2018, leadership from Wayne County heard that there was some amazing work going on in Miami-Dade. So they went down to kind of see what was going on, what was the talk around town, specifically around jail diversion efforts and warm handoffs for individuals that require those behavioral health services. All of 2018, there was a sequential intercept model mapping session, and we'll talk a little bit more about the sequential intercept model later. But this mapping session provided a 3-day-long collaborative effort and space for leaders across the county to come together and get more strategic with plans that would be specific to Wayne County overall. So again, similar to what Miami-Dade did, we wanted to bring some of that here to Detroit, but specifically what worked well for Detroit. Shortly after this, there was the support of the Ethel and James Flynn Foundation, which really started our Wayne County Jail and Mental Health Initiative that was launched in the spring of 2019, allowing this work to be done. In the fall of 2020, we began to take another deeper dive into this work to see where there were gaps and where there were maybe weaknesses or opportunities and strengths to be expanded upon. After this session, this brought us to spring 2021, where we began to move forward with strategic planning and mapping, but specifically around sustainability. And now here at summer 2021, we have goals outlined across multiple intercepts and intercepts 0, 1, 2, and 3 across the sequential intercept model. And then the judges will expand on some of this in their presentation as well. Next slide, please. Nancy, are you going to expand on this?
Nope, Judge Burton's got this.
Perfect. Take it away, Judge Burton. Thank you.
You're on mute, Judge Burton.
Go.
You want me, you want to be able
There
to
you
hear
go.
me, huh?
No,
There
Well, that seems reasonable. The sequential intercept model is what we use, and it's actually something that's used nationally to identify the various steps that we need to take in order to provide for those who may have behavioral health issues. You'll see at Intercept 0, where we have crisis lines and we have a crisis care continuum. And then also on Intercept 1, which is typically where police are contacting individuals, picking them up, taking them into the ED, or perhaps taking them to a place where they can get some immediate assistance, such as team wellness. Each of these steps that we take takes a period of time. Intercept 2, Intercept 3, Intercept 4 and 5, 2 and 3 typically relate to when there is going to be detention. That is, police have taken someone into custody, they've taken them to a court, get into the court system. You'll hear more from Judge Kenny about Intercept 2 and 3. And then finally, when they move out of the jail system or the criminal justice system and back into the community. These are all steps that we think we're gonna experience as we go forward. I can tell you that where I do most of my work is in Intercept 0 and 1. I'll talk about that a little more in a moment. Then you'll hear from Judge Kenny about 2 and 3. And then 4 and 5 are areas that we're gonna really need your help as members of the commission going forward. So if we can go to the next slide. We've had, through the Wayne County Jail Mental Health Initiative, certain outcomes that indicated. We've talked about the Intercept 0 and 1. We have what is called a crisis intervention team that does training primarily for police in and around and through Detroit, as well as there's a police mechanism that utilizes law enforcement assisted diversion. We have in our county, we have actually at least 2 mental health courts, one in the 29th district and also one in the 36th district court led by Judge McConaughey, who's chief judge of that court. What we've been able to accomplish, particularly with the great assistance of Judge Kenny, the staff, sheriff department, police department, is a migration or mitigation, shall I say, of COVID. And you'll hear more from Judge Kenny about the Wayne County Jail occupants and how COVID has affected them. Livonia Police Department, they have really stepped up, and they've taken the position that they ought to have social workers on site to handle these emergency hearings, unlike simply asking a police officer who may not have the expertise to deal with these kind of things. Livonia has hired 2 people. That's really groundbreaking, believe it or not. And then we're talking about hospitals, and you've heard the phrase CCBHC, which is Certified Community Behavioral Health Center, partnership with the probate court. And then you've also, I think you may be familiar with DWIN, Detroit Wayne Integrated Health Network, which provides great assistance by way of staffing of 911 dispatch with behavioral health clinicians and providing directions. And then there's the inroads for providing information and sharing. But I want to give you some information that hopefully will provide you with a better understanding of what these intercepts actually mean, particularly as it relates from my presentation on Intercept 0 and 1. You heard us talk a little bit about going down to Miami-Dade. There were actually 11 of us who went down back in, I think it was early 2018. And what we learned, and the reason we went down there is because we wanted a model of to develop for our area. For example, in Miami-Dade, they've got 36 communities. We got 43. They have 6,000 crisis intervention training sessions that have occurred for police officers. We're in the process of completing that. They've watched their jail population drop from 7,200 people in 2017 down to 4,400. That allowed them to close an actual entire jail and also created, and this will be of interest to you, created $12 million savings per year. And so that's something that we are definitely working on. You'll hear from Judge Kenny in a moment about that and the numbers that we've been able to experience by way of COVID-19 mitigation to a much, much lower level in terms of who occupies the jail. We utilize, or Miami-Dade utilizes, recovery peer specialists. That is people who actually have been in the program, who have been diagnosed with perhaps a mental illness, have actually been in a jail where they really should have been in some form of treatment. There's a person, his name is Justin Volpe. He is the poster child for what a peer specialist should be. He experienced all of those things I've talked about, and now he is a connection between those who come into the system and those who are attempting to assist the individuals. He's been clean, as he indicates, for at least 10 years. He's a model, and in fact, part of our behavioral health unit, which I'm going to talk about in a moment, will include a position for a recovery peer specialist. I would also note that that jail that was closed, they've in Miami-Dade, they've located a closed psychiatric facility, and they are in the process of renovating. In fact, the citizens of Miami-Dade have been so impressed with Miami-Dade diversion program that they approved a $64 million bond issue that would allow for this facility to come alive. And as I say come alive, it becomes a one-stop shop, if you will, for jail diversion, crisis stabilization, short-term residential treatment, outpatient behavioral health treatment, that there's a primary care treatment services component to this operation, and employment services, which is critical because they're going to be leaving that system, and there's an opportunity to put in place a job that will give them the kind of things they need to act on an individual basis or on a basis that is good for us, for them, and the community. We aren't doing that. We aren't going to renovate a facility and ask you for $64 million. But we will ask you for some money, but way down the road, I think we'll be asking you for some money, but we'll have to show you what we're doing. And in that context, I want to share with you, and maybe the next slide will provide that. Can we move that? Yes. Part of developing this behavioral health unit, we brought together a group of really talented, dedicated people who are willing to take a lot of time to pull together ideas about how we can best transition from the Center for Behavioral Health and Justice to the Behavioral Health Unit. And you know what it says is in Wayne County Probate Court. We have decided we're going to put it there. Why? So we can watch it, make sure it works, and so we can accumulate data that will demonstrate what's working, what's not working, and how we can fix it. But the people we brought on, Judge Mack, you may recall, former county commissioner, former chief judge of probate court, former state court administrator, and he's always active. He chaired our assisted outpatient treatment component of what we're doing. Our assisted outpatient treatment allows us to address that intercept zero, allows us to make certain that we get people assistance without putting them in the hospital, without putting them in jail, without bringing them to court, but an opportunity to have loved ones assist them, and also to train those in the community who come into contact with individuals who may need this assistance. I'll give you just an example. In Miami-Dade, they have what they call frequent familiar faces. They have about 10 people that come in over and over again and cost millions of dollars. We have identified in Wayne County Probate Court, there are 57 people who have been petitioned at least 10 times, all the way up to one person who's been petitioned 34 times in the last 5 years to come into court to get hospitalization or get treatment. That is to us and to Miami-Dade the definition of insanity, where you do the same thing over and over again and it doesn't work. Clearly we need to, we're looking through AOT to help make it work. Chair Bell, who really is a visionary, she saw the value, as did this county commission in 2015, to involve itself in the Stepping Up program and to make it happen. And she has dedicated herself over these last several years, even agreeing whenever we call on her, and we do call on her regularly, to chair the information sharing and problem solving component of what we're doing. And what is that all about? I mean, why is that important? Because it's amazing how many silos we have. And we've heard that phrase, silos, but it's really silos of separation is what I call it. Because clearly we have resources that we can better use and utilize in a way that will be successful and beneficial for the citizens who come into our community. So I'm glad that Chair Bell is working hard on this and has agreed to be chair of that and completed her duties actually recently. That gave us the direction that we need. We also have hospitals involved, and we have DWIN heavily involved. I would note that the interim president and CEO of DWIN, Eric Doe, serves on the information sharing and problem solving committee with Chair Bell. But then there is a unit called Sober Center and Crisis Drop-Off. What's that all about? We've got two co-chairs, one from Henry Ford Health System. Her name is Dr. Jennifer Peltzer Jones, and also Jacqueline Davis, who is Director of Access and Crisis Services at DWIN. They have provided great guidance in terms of how they can coordinate the crisis drop-off issue through hospitals and EDs and crisis facilities such as Team Wellness or through GERA. So I would also note an important component, and I'm almost done, an important component is DWIN is in the process of rehabbing a crisis assessment center over on 8726 Woodward Avenue. If you get a chance to drive by, please do, so you can see at least where they're located. And it's going to take some time to get them moving along, but it'll provide a very significant issues similar to Miami-Dade, not all, but similar. And we're going to have 12 adults and 6 children in a crisis stabilization bed units, separate obviously. There'll be a crisis residential unit of 15 beds where people can stay in the facility for up to 14 days. And then there are 5 beds for sober living. Sometimes that's just what is necessary, and they can stay in a facility for up to 23 hours. And then finally, Senator Stabenow, along with Senator Roy Blunt, were able to create a legislation that allowed for a number of states to be selected to bring in certified community behavioral health centers. We already have 18, but we needed more. And so through the efforts of Senator Stabenow particularly, 5 new organizations have just been brought on board, and they are going to receive some $20 million new funds from the federal government to address mental health issues, addiction services issues. And we're extremely excited because all of those units have been involved in our organization and have worked with the assistance of the chair, Carrie Walker, who's CEO of the Guidance Center, has brought it forward in a fashion that we have great confidence that we're all communicating and streaming, coming together on one wheel, all the spokes working together. And so we're very, very excited. Well, the final part of what I'm supposed to talk about today, and I realize I've gone a little while longer than planned, is that the behavioral health unit is a unit that doesn't exist anyplace else in the state. It's a unit that we've all decided, and we've had so many people work with us. This is the way to implement some of the things, a lot of the things, not only Miami-Dade has provided, but also for the Center for Behavioral Health and Justice. They're moving on to intercepts 2 and 3 and beyond. We're going to take their place in that regard. The probate court is going to assume those duties. We're going to create potentially savings of millions and millions of dollars in our county. I think I gave you the example about Huron County, which has basically 10 people, and they've been able to save hundreds of thousands of dollars just in our small state, our state alone. So it is with great pleasure and hope that I can, and I don't know if did we get to the next slide that talks about behavioral health? Did I get ahead of myself? Oh, that's not me. I'm almost done. Then I'm going to turn it over to Judge Kenny in a moment, but behavioral health unit is extremely important. And I'm just very, very excited about it. And I look forward to hearing any of your questions that you have. I'm going to throw it now to Judge Kenny to talk about intercepts 2 and 3. Judge Kenny, you still there?
It's on mute. Unmute yourself, Judge.
Sometimes judges don't want to talk. We just want to, and we think that I guess we mute ourselves because we think you don't want to hear us, but we're going to talk anyway.
Well, thank you, Chair Bell, for inviting Judge Burton and I to appear and share with you this morning, and also our thanks to the commission that is so devoted to this notion of doing something to change the Wayne County Jail from being the largest mental health treatment provider or facility in the state of Michigan. That's not right. That's not right. I think we all recognize that that's the case. And I was fortunate enough to be part of a team that went to Washington, D.C. At the invitation of Chair Bell with regards to the Stepping Up initiative. And I would like to think that the fruits of what have been accomplished thus far are as a result and a continuation of the commitment that this body has to the notion of getting appropriate treatment for those who are severely mentally ill. I'm going to talk a little bit about what are we doing with those who are seriously mentally ill and find themselves charged and find themselves in the Wayne County Jail. Certainly the ultimate goal of our Wayne County mental health diversion project here is to put much of the emphasis on what Chief Judge Burton has been doing, and that is to utilize resources and divert people from the criminal justice system altogether if these individuals are involved in behaviors that do not pose a serious risk to public safety. Now, as somewhat of a disclaimer with regards to this particular page that's up on the screen, the comments of great job, that's not my writing. That comes from Wayne State and those folks. I don't want you to think that we are sort of self-aggrandizing here at all. But what I do want to talk to you about right now are two of what I view as the most important points with regards to those who are seriously mentally ill and find themselves being booked into the jail. The two most important points, in my view, are what happens when people come in the door of the jail. and they're being booked. What is being done to screen them, to find out what are their needs? What is their illness? What kind of attention needs to be given to those individuals? And a behavioral health screen right at the time of jail booking is really critical. As I'm sure all of the commissioners understand, there are people who are seriously mentally ill who find themselves caught up in the criminal justice system. And not only are they mentally ill, but they are self-medicating with street drugs rather than taking the kind of psychotropic medication that we think would be helpful for them. So there are people coming into the jail who have drug problems as well as their mental health problems. We need to make sure that there is a better job that we are doing screening and finding out what are these issues when they first come in the door. Obviously, people going through withdrawal, the jail needs to know about that. Knowing what kind of mental health problems exist when people come in the door, hopefully is going to eliminate suicides in the jail. And so we need to do a better job. The data that has been collected for us has indicated that the current staffing situation that we have at the jail has only been identifying only a small part of the population who really are at risk, and we really need to know about that. The second equally important component part that we need to give attention to is improving the jail discharge service plan. Many of the people who end up in the Wayne County Jail who are severely mentally ill are people who have been off their medication. And we don't want to just, when they are released, just open the door and let them walk out. To me, it would make no sense to do that any more than somebody who would be who gets arrested this morning. If they're released from the jail in early February and they're released from the jail, all they're wearing is a t-shirt and shorts, it's going to help them if they're released in January. So the jail discharge services are going to be important for several reasons. One of them is that the statistics and the data that has been gathered, and you can see it in the full report that Wayne State has prepared for you, those who are released from the jail who get a connection, particularly with DWIN, have a better chance of making that connection again, getting reinstated with their mental health service provider and getting the kind of help and treatment that they need. Now, along with that, we feel that we may be coming back to the commission asking for some money for the peer support, what we call the navigators, those who we have utilized under a grant program to try to stay in connection with those who have been released, to stay with them for the first 8 weeks of their release, to make sure that they keep all their court appointments, but more importantly, they keep all of their mental health appointments, because that's going to create the kind of success that we are looking for. Since we have been involved in this particular project, I have been working with a great team of people from the Sheriff's Department and treatment providers and busting out of the silos, if you will, to deal with ways that we can get those who are severely mentally ill and not posing a risk to the public safety, to get them quickly identified and out of the jail and into treatment. Back in 2017, the data indicated that those who were severely mentally ill spent 41 days in the Wayne County Jail on average. before they were released. As a result of our efforts, we've reduced that to 30 days. So reducing it by 11 days, I mean, that may not seem like a ton of time, but really it's reducing it by a considerable percentage. And we're continuing to work on that. And as you can see from the slide, the efforts that we have taken is that Wayne County is now leading the state of Michigan in reducing jail time for people who have severe mental illness. The average length of stay in Wayne County is being reduced. And as a result of making the connection through DWIN, recidivism is going down as well. So we are, in fact, making progress. And if I can just take a little bit of an aside at this particular point, I know that there is concern about the Delta variant. And as we all know, when you can't socially distance, as the inmates can't inside the Wayne County Jail, there is a very great concern that we have about COVID spreading like a brush fire. I'm happy to indicate to you that last year, we went ahead and there were a number of people involved. There were a great number of people from the county, people from the public health sheriff's department, all working together. I contributed a little by signing an order that indicated that everybody who comes into the jail, when they're booked into the jail, had to be COVID tested. And we have them quarantined until the test results come back, and then they are housed accordingly. We have had great success. There has also been an exceptional effort to get inmates vaccinated and to do an education process to get them vaccinated as well. And I think that over the past, I think since June of 2020, the positivity rate for COVID amongst the inmates has been about 2%. So I think that's a great testament to the Sheriff's Department, all the other participants and team members who have done that. We have the next slide, please. So let me tell you a little bit about what we want to continue doing. Judge Burton alluded to an issue that he's dealing with in probate court. It's an issue that our group is looking at as well, and that is this familiar faces. And what we did is we asked the jail, the Sheriff's Department, to go back and take a look since the year 2000, who are the people who come back the most frequently to the jail? Now, we know they're not out there shooting people, because if they wouldn't be coming back over and over again if they're shooting people, sooner or later, they're gonna come to grips with the criminal justice system, that's for sure. So we have, on our end, we have taken a look at what we're calling our top 25. Who are the top 25 people who keep coming back to the jail? And I have to tell you, I'm almost embarrassed to say that the number one person on our list since 2000 has been booked into the Wayne County Jail 74 times. Now, that means that certainly we're not doing it right. Whatever we're doing, it's not working. So knowing that we have people who have been booked into the jail over the last 20 years, 74 times, 50 times, 40 times, we're taking a look at these individuals. We're using the data to get them connected with the Detroit Wayne Integrated Health Network. We are going to take a more intensive look at what needs to be done to supply the kind of services for these individuals, particularly the mental health or substance abuse services that will help them develop healthier lives. And we are also working to develop through the software an icon, if you will, that will pop up once someone who is in this top 25 gets booked into the jail. They'll be flagged so that they can immediately be given special attention. We are going to be working to get real-time information shared between DWIN and the Wayne County Jail so that programs and assistance can be developed to provide mental health services to get people out of the jail more quickly. We're also going to be working with the jail medical provider to come up with the kind of jail discharge plans that will help with regards to success. And we're also going to be working with the district courts to provide them with information and resources so that they can send people to these mental health providers right away, rather than sending them to jail in the first place, so that we have to then take the effort to get them properly situated. So those are the kind of efforts we're taking. We're looking to also have a dashboard that the Sheriff's Department is working on to track what kind of progress we're making here. We develop valid kinds of administrative jail release formats that will enable us to apply the same measuring stick to everyone who is in the jail. Next slide. Finally, what I want to mention to you is the fact that one of the other efforts that we are going to be making is consistent with what the state is focusing on, and that is trying to work with the district courts to not have those people who need competency evaluations. In other words, evaluations as to whether or not they are mentally well enough to go forward in a court proceeding. To avoid doing that on district court misdemeanors and just have people plugged in to mental health programs. Because right now, the misdemeanor cases are given a lower priority by the Center for Forensic Psychiatry. And the fact of the matter is, these individuals end up spending more time in the jail than their case provides for, quite frankly. So these are the kinds of improvements that we think can be made. Wayne State has documented that we are making improvements. There are positive signs, and we're building on that. And we are grateful for the support that we have from your leadership as well as the entire commission. Thank you.
Thank you, Judge. Is Judge Burton going to wrap this up now? Or we're going back to, you're on mute, Judge.
I will be happy to wrap it up. I think the next slide, I don't want to spend much time on it. It's just the Michigan Joint Task Force on Jail and Pretrial Incarceration recommendations. I thought as a legislative body, it'd be significant for you to look at the legislative priorities and how they relate to what Judge Kenny and I have been talking about this morning. We really appreciate you taking the time. I know when I was on the commission, I never let people talk this long. So we're grateful for that. And I hope we get invited back, even though we did spend a lot of your time. I think I will apologize to you. And as I think about it, we should have stopped a little sooner, I suppose. Be it as it may, we'd love to have questions from you. And if you think this is not the time, we'll be happy to have you share them with us. But you can see from the information offered by Judge Kenny and myself, as well as Nancy and Tyler, we're really excited about this, and we're really, really pleased that we're getting to this point. So any questions, we're happy to field them.
Thank you so much, Judge, and we'll make these slides available to commissioners as well. Again, thank you, Judge Kenny, Nancy, and Tyler, the Flint Foundation, and just everyone that was involved, because as we stated earlier, Chief Dunlap was so very much involved. The DWIN, so many partners, everyone came together, and that's what it's about, everyone getting together to move this issue forward. Are there any burning questions that commissioners have? Commissioner Varga? Unmute yourself.
Thank you. I had mentioned, or you had mentioned that you will be needing funding. How soon will that be? I know I'll see you tomorrow, but.
You'll see us tomorrow. Well, right now we are working with the county executive on funding, and I think they'll be able to talk a little bit more about that tomorrow and hopefully in the future. But right now, we're trying to use the resources that we have available and that are currently budgeted. We are contributing, for example, in the probate court, we're taking all of our mental health employees and putting them in the behavioral health unit. And we think we're going to need 7 new positions. That's probably going to cost, I'm not sure how much it's going to cost, but at this point, we are not asking for a set amount, but we have provided a breakdown of what we think it'll cost or what it'll take to get the behavioral health unit up and running. So it's going to be about 7 new employees, or a total of 10. And I'll be happy to share that information with you and send it to you, Commissioner Varga, as soon as we get off the line, if you like.
Thank you. I would appreciate that. I'm excited. I love what I'm hearing, and anything I can do to assist, I will. Thank you.
Thank you, Commissioner. Commissioner Clark-Coleman.
Thank you, Madam Chair, and thank you, Judge Kenny and Judge Burton. So I might have missed this in the presentation, but first of all, congratulations on reducing the population of the mentally challenged. That's very important to all of us. And I know it will indeed save a lot of money. But my question has to do with, and maybe you covered this, but where are they going right now? The people that you are reducing that are from the jail right now, where are they going?
Well, with regards to those who were discharging from the jail on administrative releases, the first option we look for is whether or not there is a support system that they have. If there are family members who are a positive support for them and are willing to take them in, we certainly do that. We end up in quite a few instances, I think it's probably almost half, having them go to residential treatment, which oftentimes is like 120 days. They can get a continuation of mental health services as well as substance abuse services. And the reason we do that is that there are an awful lot of these individuals who are either homeless or what we would consider de facto homeless.
Right.
You know, someone who says, oh, I can stay with my sister for 3 days and then I can stay with a friend for 4 days. Well, that doesn't work. And having them in residential treatment gives us the opportunity to buy some time so that they can get either to some transitional housing or an opportunity to get some housing on their own. To the extent that we can get them out of the Wayne County Jail and into a stable housing circumstance, whether it's at home or at a treatment facility, we view as the best option.
And is that being funded by the mental health authority, or where the funds coming to, for instance, if they go to the residential treatment center or transitional housing, I guess you'd call that. Who pays for that? Does the county, Wayne County General Fund, or is it coming from the Mental Health Authority? Yeah, that's my question.
If I could try and address that question. On the civil side, where probate court is concerned, that is a major problem. That's why assisted outpatient treatment, which is a new component of the law that's underutilized, will help bring family together to assist, to get people who suffer from mental illness early on before they do something that put themselves in jail or do something that harms themselves or others. We're trying to get it done on the front end. That intercept zero we talked about a little bit, because that's the only way. Because we right now in the court, when people come in on a petition for hospitalization or mental health treatment, they might go into the hospital, but in 10 days they're out and they're having the same problems and issues.
Right.
Why is that? Well, currently the law does not allow us to keep people beyond the point in which they become stabilized. And so if you get stabilized in 10 days or 14 days, then you're released. And the problem and that's why Judge Kenny and I and so many others are so committed, Chair Bell, are so committed to working on this problem, because it's just not working. And this is a way we think that can address a variety of issues. We talked about all the way to Intercept 5, where we're going to put people in a residential facility or give them employment service opportunities so they can actually begin to not only stabilize their condition with treatment, but also have the dignity of a job by way of services. And those are things that have been sorely missing, not only in our county, but all over the country. And Miami-Dade provides a real method, I think, to address the very issue, Commissioner, that you're raising.
Yeah, and thank you so much. And by the way, the original tour at the Miami-Dade program, I was able to go on that one. I think it was with NARCO, one of the groups that was there. I was able to take that tour, and I agree, it's a great program.
Yeah.
Thank you, Commissioner. Vice Chair Palomero.
Thank you, Madam Chair. Excellent report, Judges Burton and Kinney. Is it possible to get an email copy or a hard copy of your slideshow report?
Absolutely. Nancy?
Yes.
Joe has already asked for it, and I'm happy to disseminate it to him to get out to all of you.
Great.
Thank you so much. That's all I have.
Thank you, Commissioner. All right, well, thank you again for taking time out of your schedule. I know you have to get back on the bench, so thank you, Nancy, for all of your hard work again. Nancy allowed this together. Tyler, excellent job as always, and we look forward to getting more information on this as we move forward. I thought it was just important to bring it to the commissioners and let all of you all know the hard work that's been going on, because we as a commission are dedicated to making sure that people in the jail are people who are supposed to be in the jail, and not those with behavioral issues who need treatment. And not, besides being humane, it also saves us money. So thank you all for all of your hard work. We look forward to another presentation after a few more months. And thank you. We'll talk to you soon.
Great. Thanks a lot for having us.
Have a great day.
You too.
Madam Clerk, next item, please.
Item number 2 is requesting commission approval of the 21 through 25 consolidated plan and the program year 21 annual action plan for the U.S. Department of Housing and Urban Development.
Thank you. Mr. Carroll, are you on the line?
I am, Madam Chair. Thank you. First of all, I'd like to acknowledge and thank you for your indulgence coming before the Committee of the Whole, allowing us to meet the national deadline of August 16th with the submittal of this plan, and also to acknowledge the involvement of your staff, especially Mary Carr, in helping us work through this. We traditionally sit down with Mary before each one of these are due and spend a lot of time with her. Because of the COVID separation this year, we weren't able to do that, and I think it sort of slowed us down. So I'd like to go into it at this point and make it rather brief, doing a high-level focus on the 5-year consolidated plan, which is actually we use the springboard of the analysis of impediments to fair housing that we completed last fall, went in the consolidated plan. It's formatted in the manner required by HUD. It establishes goals and other things for the use of our federal funds for the next 5 years. Then we go into the actual action plan, and you'll recall that we're required to submit an action plan every year once we receive our allocation from the U.S. Department of Housing and Urban Development. This year, we received an allocation of $5,689,267 CDBG dollars, $2,838,724 home investment partnership dollars, and $479,825 emergency solution grant dollars. Going back to the Community Development Block Grant Program, this is we've continued for the 3rd year in this annual plan, the changed model that we did a couple years back, where each community receives $20,000 to each of our 34 participating communities, receive $20,000 with which they use to address some of their public service needs. Traditionally, those amount to primarily senior citizen services and code enforcement activities. And then we do a request for proposal for the big the larger projects. And as several of you witnessed yesterday, we had 2 dedications. One was the Hamtramck Historical Stadium, as well as the Atwood Park renovations in the city of Wayne. Those projects would never have been done with the old system. We were able to allocate money to Hamtramck to go and do approximately $2.6 million worth of renovations to that stadium. And we were able to give about $227,000 to Atwood Park. So that is continued this year. You'll see in the annual plan that the projects have been selected and recommended to you. Also, in the home allocation portion, that includes funding for the home consortium, which involves an additional 4 communities to the 34. And that would be Dearborn, Taylor, Lincoln Park, and Livonia. And finally, our emergency solutions grant of $479,000 primarily goes for the operation of the Wayne County Family Center out in the city of Westland. So without getting too deep into any of the actual programs, I think probably it's better if I just answer questions at this point, Madam Chair.
Okay, commissioners were sent the detailed information on the projects, the dollar amount, and which communities they are in. Are there any questions, Commissioner Haydos?
Thank you, Madam the Chair. Let me start first say congratulations to Commissioners Martha G. Scott on the renovation of the stadium. What a wonderful thing to do, preserve our history. Second thing, I've been involved with the CDBG for a long time in many different capacity, and to tell you the getting away from the old system, now we could accomplish things we could never before do because of the amount of money small community get. And now it starts to show the success of the program. And I talk with some of the community leader in my district, and they very happy with that. And today, 5 years plan and too many good projects and the pipeline. I'd be honored to make the motion to move this item and open it for discussion.
Okay, it's been moved by Commissioner Haydos. Is there support?
Support.
Support by Commissioner Maydoun. For discussion, questions. I have a question, Mr. Carroll. If any changes should occur to any of the items that you have listed, either they determine that they need more money, or if a project is scrapped altogether, how would that be handled? Will you come back to us for approval or update for that plan? How is that handled?
Well, Commissioner, we asked for delegated authority on the CDBG funds. The home funds all come back to you at contract stage, as well as the ESG. And I think your question really is, in the CDBG arena, if something happens that requires more money or the cancellation of the project, do we come back to you? We traditionally have not done that because, to be real honest with you, the communities have not been very good at suggesting the cost of each one of their projects. So we've tended to make that up through other unallocated dollars. For instance, the Hamtramck project yesterday started out at $500,000 and wound up being a little bit over $800,000 by the time of CDBG dollars. So that has not occurred, and I guess we would be open to any discussion at this point to do that.
Okay, thank you. I see Commissioner Counsel Johnson's hands up. Go ahead, Commissioner Counsel.
Thank you, Chairwoman, to this honorable body. So with regards to the CDBG, this body has over the last several years granted delegated authority for the execution of the contracts for the projects that are listed in the plan. In the reason for the delegated authority for CDBG as opposed to ESG and home is because of the level of detail that is in the plan regarding the CDBG's projects and allocations. So you have a rough number, you have a project, you have a community. So you have some information to know how the allocation for the plan will be spent. And that's the reason for delegated authority for CDBG as opposed to home and ESG, where we don't get that level of detail. So we've had, and I thought we had this discussion in the past, Terry, about changing the projects. So if the project or information is listed and there is to be a change, for example, if you want to add a project, don't you come back to the commission for approval to change the plan to add a project?
Yes, ma'am.
Okay, so you're saying that you would delete a project without coming back to the commission. So then that money does what? It sits there, but before it can be reallocated, that reallocation for the project that didn't happen would still have to come back for an amendment to the plan through this body, correct, for the CDBG?
If there's a new project, sometimes, and we try to keep it in the same community, sometimes the money goes to another project for which there already is delegated authority.
Okay, so when there is a additional project or a deletion of a project or any changes in the dollar amounts, I'm requesting that that goes to our Economic Development Committee for an update, if it should happen. Thank you. Any questions from commissioners? Looking for hands. Commissioner Anderson?
Move approval.
It's already been moved. Oh, yeah.
It was just supported.
It's already been moved. Yes, thank
It's
you.
already been moved.
Okay.
I basically wanted to say I did not support this change and originally. And because I saw so many communities now getting only $20,000 per year, taking a huge hit for services that they were providing to the needy. One of the issues was one of my communities had a repair program to help rehab homes that they were people that met income guidelines. Other issues that and other programs that they supported with their CDBG dollars that were very directly geared to those that are in need. I just don't like the idea, as I've stated before, with delegated authority to allow that much control over projects that are chosen. I think it's I think we'll see down the road that it's not. I realize folks that have been getting a lot of projects in their district are very supportive of it. And I respect that, but it's not something I think that serves the total Southeast Michigan or Wayne County area the way it should. But anyway, that's my piece, and I'll be voting no.
Call for the question, Madam Chair.
I see, I'm sorry, could you, I see Commissioner Colleen's hand and I
Okay,
might
I withdraw that.
allow. Thank you so much. Commissioner Colleen, come off of mute, please. Come off of mute, please, Commissioner Colleen.
I'm getting there. I'm getting there.
There you go. Thank you.
And just as a reminder, calling the question takes another vote in and of itself. Mr. Carroll, when we first started down this road of changing the CBDG system, we had a committee of folks made up of local communities that reviewed and approved the list that went forward for which projects would make the list. Is that still happening?
Yes, that committee is formed every year that then rank orders the responses from the communities back against the goals of the consolidated plan that you're being asked to forward on today.
And how many people make up that committee?
I believe.
Or how many communities, I should say?
I believe it was 5. I don't know. I'm gonna have to go back and check.
Okay. And
to that point, to the advisory board of the CDBG, it's 19 community.
Yeah.
No, yeah.
And does it take a vote of that advisory board to approve the plan that shows up here?
We have not taken the a vote of the advisory board for the last 2 years.
Okay, but they are in on the discussion of what the proposals are.
Prior to the COVID year, yes.
And will that be continuing into the future then? COVID's not over. We'll see what happens after.
Yeah, we have to figure out how we're going to do it post-COVID.
Okay, but I think that's an important ingredient here. Since we do have that advisory committee, that they play a strong role in putting the list together.
Yes.
All right. Thank you, Madam Chair.
Thank you. Commissioners Martha G. Scott.
Thank you, Madam Chair. I just wanted to respond to Commissioner Haddis Thank you so much for your remarks regarding the Hamtramck project yesterday. Thank you, Chair, for being there and all the wonderful partners that came together. It's just going to be the most wonderful project that anyone can have. So hopefully everybody will be able there for the ribbon cutting. So thanks again. It was just wonderful.
Well, I'm sorry I missed yesterday, but I have through the winter, I never have a cold. Got the summer last week, I catch cold, and I said that put me away from going anywhere because you know how sensitive the people now when you sneeze or cough.
Yes.
So that's why I wasn't there.
All right. Thank you for your words.
Yes, thank you, Commissioner Scott. It was an awesome, beautiful day yesterday, and to see those little tiny tigers was marvelous. And hopefully we're building on new baseball players for the future. So it was a great event.
Yes.
I'm sorry, Commissioner Baydun.
Yeah, Madam Chair, I just wanted to also congratulate Commissioner Scott on this major project in her district. And I'm sorry I couldn't be there because we had the budget meeting yesterday. That's why I couldn't be there. But we'll be there for the ribbon cutting.
Right. Well, that was the first meeting that I have missed.
I know.
Yes.
But I had to. And I want to thank all of the county exec staff too. It was just so many people there. It was just awesome.
It was. Commissioner Clark Holmes.
Martha G., we would never know that you were happy about this. But congratulations. It was. I saw it on TV and all that sort of stuff. So it indeed was an historic day. So congratulations.
Yes, thank you.
Thank you. Commissioner Killeen.
Thank you, Madam Chair, for recognizing me a second time. I want to remind everybody that that project that everybody's discussing right now was only possible because this commission changed how we did the CBDG 3 or 4 years ago.
Yes.
And I also want to point out here, as was presented right at the beginning, Mr. Carroll said we have $5 million of CBDG money approved to come into the county. $5 million does not go far if you spread it over 39 communities. So it's only larger community projects that can get done because a few years ago, this commission voted to change the system that we were using. Thank you, Madam Chair.
Thank you, Commissioner. You are absolutely right. I think we can all agree that the new system allows for smaller communities to really take advantage of these dollars and to have great things in their communities.
It was a good move.
Absolutely. Any additional questions?
And it brought together a lot of different partners, and that was wonderful.
Excellent.
Being able to leverage the monies that we have with the private donations and foundations, I think is key to the way we operate. Public-private partnerships are absolutely beneficial to our communities.
Yes.
Any additional questions? We do have a motion and support. We'll do a roll call vote. Madam Clerk?
Commissioner Anderson?
No.
Commissioner Basham?
Yes.
Commissioner Clark Coleman?
Yes.
Commissioner Dahl?
Yes.
Commissioner Hattis?
Yes.
Commissioner Killeen?
Aye.
Commissioner Kinlock?
Yes.
Commissioner Kniezek?
Yes.
Commissioner Marecki?
Yes.
Commissioner Baker McCormick?
Yes.
Commissioner Scott?
Yes.
Commissioner Varga?
Yes.
Vice Chair Pro Tem Baydun?
Yes.
Vice Chair Palomero?
Yes.
Chair Bell?
Yes.
Motion carries and I have Commissioner Anderson as a no.
Okay, thank you. Next item, please.
Item number 3 is requesting commission approval of a 3-year inmate healthcare services management agreement with 1 2-year option to renew between the Charter County of Wayne and NAPCare.
Okay, so about what, 5 years ago, I think it was, we changed the way we operate our jail medical and brought in a private company, WellPath. They indicated to us that they would be better able to hire nurses and to facilitate better inmates' medical needs in our jails. We are at the 5 year point at the beginning. At that time, we had binders full of information that we read through to make sure that we were doing the right thing. Now, at this point, an RFP was sent out and a new company has been selected. We don't have binders and binders of information because all of the initial questions that go into this new system were answered, but we do have an analysis of this new company that's being proposed to us today. So with that being said, I am going to turn it over, I believe, to Janelle Allen for a presentation on the new company to be presented to us to take care of our jail medical needs.
Good morning, everyone. I am Janelle Allen, the Chief Operating Officer with the Wayne County Executive's Office. It's a pleasure to be able to present on this very important contract with you. Joining me in the presentation, and I'll tell you, we will try to go quickly through this. We do have a lot of information to share, will be the Director of the Health, Human and Veteran Services Department, Melita Jordan, which actually oversees and manages this contract. Also joining us and presenting will be the Clinical Services Division Director, Jennifer Caruso, and our HHVS Finance Director, Kamal Kafaru. We'll also have a very brief presentation by NAFCARE CEO, Bradford McLean. As Commission Chair Bell just gave a nice overview of, back in 2015, when Mr. Evans started his first term, as we all know, the county was on the brink of bankruptcy. And at that time, we were charged with immediately finding ways to cut costs. So we did very comprehensive assessments of various departmental operations. When we were looking at how we were providing jail healthcare services, we realized that the county was just not equipped to provide the level of care and quality that is warranted and needed. And thus, when we were developing a recovery plan, everything else in that plan was designed to cut costs. The one area that was not designed to cut costs was in the jail health services area. We were just focused on increasing significantly the level of care. And as Commission Chair Bell said, that we did sought an outside provider too, who is far better equipped and experienced at providing this level of services. We had interest expressed by two companies. Correct Care Solutions, which you all may recall was referred to as CCS, was the predecessor of WellPath. Correct Care Solutions merged with another company, and the new resulting company is WellPath. Another company, Horizon Health, had also expressed interest, and Correct Care Solutions was selected. And as Commissioner Chair Bell, that contract started, or they started services on January 1st of 2017, and the contract will expire at the end of this fiscal year, September 30th, 2021. And while we have absolutely seen a significant improvement in services, we are recommending a new provider, and we'll highlight that in the various parts of our presentation. So next we will have Jennifer Caruso discuss as far as the process of selecting this new provider, as well as key highlights in the contract. Jennifer?
Hello, everyone. It's Jennifer Caruso, Clinical Services Division Director. Thank you for the opportunity to present this information today. I would like to start off by explaining our formal process that we took to locate a new provider. An RFP, a request for proposal, was issued. We had an extensive question and answering process, and we also took two vendors, NAFCARE and WellPath, on an extensive tour of all the jail facilities, including all the medical and related areas of those facilities. We received two qualified proposals, one from NAFCARE, one from WellPath, and the evaluation committee met several times, and we had vendor interview sessions with both companies. The evaluation committee unanimously ranked NAFCARE #1. I want to talk, this is the most important piece of this, I believe, is the scope of services that NAFCARE presented in their proposal. One of the things that we were most impressed about with NAFCARE is their staffing plan. It's comprehensive. NAFCARE included 2 discharge planners assigned to that duty station, which we do not have right now. Discharge planning is critical for continuity of care, as Judge Kenny explained in his presentation earlier. Also, the medication-assisted treatment program that I'm going to talk about in a few minutes, that also has its own discharge planner. Again, important for reducing overdose deaths in Wayne County. LPNs are robust, the number of LPNs, that this creates efficiencies across the board for us, meaning that we don't utilize RNs for every single service that we need in the jail. This allows our nurses to focus more on chronic care issues and highly complex needs within the jail. LPN coverage is 24/7. We also have medical assistants that are going to be trained in wound care, EKG services, and labs. This is critical for reducing the number of send-outs to Detroit Receiving Hospital because these medical assistants can respond to situations. They also included additional master health professionals, which are going to support our evening needs in the mental health unit. Next slide. Mental health support. So we talked a little bit about this with Judge Kenny. He presented on this earlier. Mental health screenings are going to occur immediately during this intake process. This is huge. Most providers do not do this until within 14 days of intake, up to 14 days. Mental health patients are going to have access to individual and group therapy, which is key. Also, NAFCARE has a clear process for referrals and access to support after inmates are released. Again, a clear process is important because inmates need services after they're released, and we currently do not have an enhanced discharge planning service. IT support, state of the art. It's going to include claims processing for behavioral health and substance use services. And we're going to have the relevant tools to do our jobs, to actually monitor this contract and improve services. Monitoring this contract is going to be so much easier and so much more robust with the tools that NAFCARE is going to provide us. What made NAFCARE stand out? Well, I've already started talking about that, but I'll continue on that right now. Real-time medication administration and verification. This system works even offline. So if there is an issue, it works offline and online. It includes a timestamp for ordering and administering medication, which is something we do not have now. We don't have a timestamp for that. Medication history also displays this information, and it allows us to see when an inmate refuses medication, or perhaps when an inmate wasn't in his or her cell when medications were passed. Timely receiving screenings. This is a critical step, intervention step, provides us a wealth of information, a history of illness, history of mental health status, current medications. This allows us to better treat and care for the inmates immediately. Delayed screenings are going to lead to a slew of adverse health situations. Stat care, I'm going to defer that to NAFCARE. They're going to present additional details on stat care, which provides us with real-time consultations with nurse practitioners 24/7. We also have a detox monitor. So alcohol and drug detoxification services. Any patient at risk for withdrawal are electronically enrolled in this detox monitor. NAFCARE's clinical team will have a single view readily available to them at all times so they can properly monitor and treat these individuals in the detox unit. Also, one big thing that impressed me and other members of the evaluation committee, implementation of TechCare, which is their electronic health record, allowed Maricopa County to get out from under a 38-year consent decree. This is huge. They met 31 requirements were met with the addition of TechCare. Medication-assisted treatment. We are going to actually provide treatment to individuals that are struggling with opioid dependency. This is something that people do throughout the country, and I am pleased to be able to offer this here in Wayne County. This is really exciting. Only 1 in 20 jails and prisons offer the medication. So we are going to be one of a very few individuals and facilities that do this. This is a much needed program, and it's a huge addition to our scope of services. We were previously unable to implement MAT in our house with our current provider. Earlier this year, we partnered with Wayne State and DWIN, but we are only offering this service upon discharge to inmates. So a mobile unit does come to the jails right now and offers individual services upon discharge. Now we will have it both in-house and after. Recruitment of staff. Janelle spoke about this earlier, about needing a company to come in and help us out with staffing and make sure we maintain these staff levels. NAFCARE is going to assign a dedicated recruiting team to our facility. They build and maintain their own pool of PRNs, which are nurses that are needed when necessary, staff who can quickly cover shifts. They also use ShiftHound, which is a software which alerts all employees to open shifts so they can pick up shifts, and that will help as well. Staff retention, I want to talk about this. So NAFCARE's overall staff turnover from 2015 to 2020 averaged about 9.6% compared to the turnover of WellPath, our current provider, at 31.2% during that same time period. Utilization management. In 2020, NAFCARE processed over 180,000 claims and posted over $103 million in payments. The claims are easily traceable in their system. This is something that is going to benefit us as well. We also have a continued quality improvement program here that is robust, including patient satisfaction surveys, which were not being utilized before. This is really going to help us. They have a dashboard with a system that is built to send warnings and alerts to all their medical staff when any patient parameters are out of whack, or if an appointment is missed or anything is out of bounds. The system flags all chronic care patients, which ensures timely delivery of services. And this includes continued medications for people with chronic conditions. Next slide, please. Oh, yes, I forgot one important point here. NAFCARE's recognition of both existing unions and ongoing good faith bargaining sessions. So NAFCARE engaged with unions early on, which they have been highly collaborative with this effort.
Thank you, Jennifer. Before we move on now to discuss our internal oversight and controls, I would like to, while we've highlighted some of the key features of what's made them stand out, I think it's in our interest to be transparent. We know that it has been reported that NAFCARE did have a recent settlement with the Department of Justice with regard to a claims matter. So I'd like to ask the CEO of NAFCARE, Bradford McLean, to briefly discuss what that matter entailed.
Absolutely, Ms. Allen. Pleased to speak to that. So NAFCARE, one of our lines of business is we're the largest partner to the Federal Bureau of Prisons in providing specialty healthcare services to the residents in a network of 30 federal prisons. So we provide those services either off-site or on-site in the prisons. We received in June of 2020 a request for documents and information from the Department of Justice in regard to about 6 years of our services to our network of federal prisons. So it was a huge investigation and undertaking. We were very cooperative. We provided all the documents and information, answered their questions, and we went above and beyond in doing our own internal audit to look for any possible area of concern. This was a massive undertaking because it consisted of over $500 million of claims that we provided across the country. Through that investigation, we did find an area of concern. Some years ago, we set up an on-site cardiology clinic at the federal prison in Terre Haute. And as part of twisting the arms of these doctors to come on-site and provide the service, which is much more convenient, saves money for our clients, helps our patients to provide that service in the prison, the doctors asked some of our administrative staff, hey, would you help us with coding? We'd like your help filling in the CPT codes as we provide services. This was not known to management and should never have happened because the doctors are in the best position to choose the codes and make sure the codes are correct. So it was an honest mistake. We looked at the issue and brought it to the Department of Justice's attention before it was a focus, and reached out to them about resolving it. In terms of the kind of cost implications of those services relative to our overall universe of services, that consisted of about less than 0.07% of the claims we processed over that period. So, it was understandable in my mind that we did have an area where we needed to improve our processes. So we engaged in a collaborative discussion with the Department of Justice, and we were able to resolve that matter through a settlement. Thank you, and I'm happy to answer any further questions.
Thank you, Brad. Next, we're going to have our HHVS Director, Melita Jordan, discuss the county's enhanced controls and oversight to ensure that the company will be fully compliant and to be able to quickly identify any irregularities or deficiencies. Melita?
Good morning. Again, my name is Melita Jordan, and I am the Director of the Department of Health, Human and Veteran Services. Again, it's an absolute pleasure to come before this esteemed board and present this morning. As many of you know, just a short 90 days ago, you approved me to be here. And so I am still learning getting my sea legs. But one of the things under the leadership of my boss, Ms. Janelle Allen, was to also give attention to this one particular matter in terms of clinical jail health. And so again, as I arrived here, I turned my attention to not only visiting the 3 correction sites, but more importantly, had time also to meet staff and spend time there along with Jennifer and her staff. So I would like you to know that in doing so, a few things that I observed and began to immediately think that we needed to put in place as we move forward in evaluating this new contract, and also from lessons learned, I think, over the 5 years, is to say that we need to, 1, establish an advisory board that would include internal and external stakeholders. In doing so, that will help us to improve health status and outcomes of our inmates. It would also help us to decrease exposure to any substandard healthcare practices, reduce public health risk when inmates re-enter into the community. It would allow us also to monitor key metrics for grievance, response, and disposition. In addition to, think very much the earlier presentation that we heard from Chief Justice Burton and Chief Justice Kenny has really given me also the insight and understanding that how important collaboration is across the various agencies in terms of utilizing a performance measurement system to help us track and ensure compliance with goals and objectives. So therefore, also have developed a strategic framework for us to enhance the quality, our coordination, as well as the excellence in all aspects of our work, and adhering to the highest medical, correctional health standards, as well as ethical behavior. As we move forward with this, I was excited to hear about their dashboard, because that is one of the things that we're developing also is a dashboard. And in terms of developing the dashboard, we will be able to have real-time monitoring of a number of key metrics as it relates to healthcare services. So again, as we move forward, this will be an opportunity for us to have good, improved performance as well as fiscal oversight of the county in terms of this contract as well. So again, as we maintain core values and looking at service, integrity, and collaboration will be key for us to move forward in managing a new contract of this magnitude.
Thank you, Melita. Now our HHVS Finance Director will provide a brief overview of the internal financial controls that are implemented and will be in place as we monitor this contract. Kamal.
Thank you, Ms. Allen. Good afternoon to the commissioner, commission staff, and the executive leadership. Well, I want to piggyback on what Director Jordan said, which was lessons learned. As you know, when this contract started years ago, we did have a lot of lessons. So I want to give some historical context real quick, because I think the commissioners will appreciate this one little thing we did to bring some more oversight on monitoring this contract. When this contract started, the OAG, well, a few years after it started, the Commission OAG office did I think an operational review and found a few things that we really had to deal with, which was we didn't have enough financial control over this contract. And one thing that was highlighted that, and why they stressed that this was a profit sharing contract. So we needed things in place to make sure we validated all the expenses. So once we got that lesson, my team, along with the department leadership, went back and we put together a fiscal review process. And what you have here is a few highlights. We had to work with WellPath to submit information on a monthly basis, well, on a quarterly basis. One thing we did with NavCare, instead of working stuff on the back end, we changed it and we're going to get information on the front end. That is a key point I want to highlight to the commissioners, because most of the commissioners would know we had to do quarterly reviews on the WellPath contract. Now, on a monthly basis, we will receive with the invoice supporting documentation so we can review and then of course reimburse NavCare on their information. On this slide, you see statistical sampling. Basically what we do is we request their general ledger, and from their general ledger, we take a sample of all their expenses and then just go through and verify with the receipts in a nutshell. The only thing I would say is for the first maybe month or two, it's just us getting used to each other's process and getting used to their data. Other than that, if there's any questions, I'll take them now or.
Well, actually,
talking,
NavCare, yes.
Like you was on mute.
Sorry. Can you hear me?
Yes.
Yeah, I hear you now.
Okay. NavCare, we just have a very brief presentation now from NavCare. And let me pull this up.
While Ms. Allen is pulling up the slides, I'll just begin by saying I'm Brad McLean. I'm the Chief Executive Officer of NavCare. Madam Chair, members of the committee, really appreciate your time. Appreciate the opportunity to address you all. I just have a quick 5 slides that I'm going to go through with assistance from Suzanne Moore, our Chief Operating Officer, and I also have on the line a number of our senior leaders in information technology, clinical, operational, legal, finance, pharmacy. So if you have specific questions, have the team members here to really dive into any areas that may be of interest to you. So NavCare is a company that my father, Jim McLean, started 31 years ago. He was working in running a pharmacy that he purchased from my grandfather, a little corner drugstore in Birmingham, Alabama. Started filling prescriptions for a jail contract in Georgia. Learned about correctional health care and had a vision that he could create a better model to care for a high needs population of people who are incarcerated in our jails and prisons. Today, NavCare has grown considerably from that vision. We operate in 29 states. We have 37 comprehensive healthcare clients. As you've already heard from Ms. Caruso, we've developed our own electronic health record and operating system, TechCare. So in addition to being a comprehensive healthcare company, we're a software company, and we license our software to a growing network of jails and prison systems across the country, including some of the largest jails in the country. We also, as you heard, manage specialty needs for a large network of federal prisons and provide dialysis in prisons and jails. Our mission is to improve and save lives in corrections through innovation and excellence. Because we have no outside shareholders, we are able to focus on that mission, care for our patients, and serve our clients. And that is one of the many things that makes us different in the field. Next slide, please. With NavCare, we are very cautious and deliberate about which opportunities we bid on when RFPs come out. We are dedicated to maintaining a sustainable curve of growth and to finding those local government, local, state, federal government clients that share our values and are going to be good partners with us. We can have the best people, the best systems, the best technology, the best policies, but without a strong partnership with our local government partners and our custody partners, we cannot achieve the level of success that we expect and demand of ourselves. So part of why we are here is we are excited about Wayne County. We are excited about all of you. I'd be remiss, Madam Chair and members of the committee and the commission, if I did not say I couldn't be happier or more impressed with your team. I know you know this. You have an incredible team of people. We've enjoyed working with them. They work days, nights, weekends, whatever it takes. So we're excited about that partnership, and even more excited about the partnership when I hear the presentation from Chief Judges Kinney and Burton. We learn about the progressive, the good initiatives that you have to divert individuals who don't need to be in the criminal justice system, and to do some cutting edge things through your Stepping Up initiative. As a software company, as a technology company, we are able to do more than just provide care in the jail. Should you desire assistance from us on those initiatives, we're happy to support you, as we've supported a number of other clients. And our Chief Information Officer, Byron Harrison, can speak more to that if there is an interest. We were excited to recently be the first to win the Pinnacle Award. Is a new award created by the National Commission on Correctional Healthcare, or NCCHC. The Pinnacle Award is given to any facility that achieves accreditation in all three NCCHC areas, so core medical care, the mental health specific accreditation, and opioid treatment. We achieved that working with our Hillsborough County, Florida partners. We're the first in the country. Of course, you want to know is why does it matter to Wayne County? Well, two reasons. First, we have an incredible team that manages accreditation for our clients and ensures adherence to those NCCHC standards, capably led by Dr. Jeff Alvarez, our Chief Medical Officer, and his team. We have a 100% success record in obtaining and retaining accreditation for those clients who want it, and you can count on us there. We also have significant experience working in large jails, and we're able to bring that experience to you as far as innovating and enhancing your programs. Next slide, please. With NavCare, we surround Wayne County with a suite of services to care for your patients and to provide better outcomes for your community. It begins with our proactive care model. Many correctional healthcare systems tend to be more reactive. You wait for patients in the jail to submit a sick call and then you respond. Certainly that reactive component to the healthcare system is important, but everything that we do, everything that NavCare has created is focused on that proactive piece. We do much more at intake with a aggressive screening for medical and mental health needs, and history and physical examination for those higher needs patients right up front in booking. Get as much information as we can. And you'll have nurse practitioners on site 7 days a week during the day with our staffing. But at night, when you don't have an advanced clinical provider on site, as Ms. Caruso mentioned, our StatCare team, which is unique in the field of correctional health care, will be a group of Michigan licensed nurse practitioners that 24/7 have access to those patients through our electronic health record, working with that booking nurse. And they're able to immediately start treatments, medications, help stabilize those patients until they can be seen by your on-site provider. Again, our TechCare electronic health record is a comparative advantage. We have everything that we've built in our systems is designed around NCCHC and processes and how care is to be delivered in the jails, and will lead to both better care for your patients and also efficiencies that will help the custody staff as well as the nursing staff. And clinical providers be more efficient with their time. We're very excited that you're investing in a medication-assisted treatment program for your patients with opioid use disorder. Believe that is a very wise investment. You know, we do see patients come into the jail with opioid use disorder. They will lose their tolerance for opioids over time, have strong cravings when they leave the jail. There's a high risk of them going back to using a level of of drug that would not have killed them before they came into the jail, but can lead to overdoses and deaths. And we have seen, and there is tremendous data to support what you heard from Ms. Caruso, that investment in care in the jail will lead to saving lives and preventing overdoses. In addition, we're very aggressive in managing our patients through opioid withdrawal using buprenorphine to ease their suffering and reduce their risks. So there's just so much more that we're going to bring in that area of addiction medicine, managing withdrawal, and helping patients to manage their cravings as they leave the jail and hopefully abstain from illegal use of opioids. We have an in-house pharmacy. That means you not only get the right medications at a cost savings, but you also have the quality assurance function of our pharmacy team, always watching patient records, always making sure that our patients are being properly cared for. Darrell Knight, our chief pharmacist, is with us if there are questions about our pharmacy. Again, you've heard about Stack Care, but it is unique in the field of correctional health care, and I think will provide just a critical additional level of care to your facilities. Next slide, please. So NAVCare is really committed to bringing the heroic folks who are doing the frontline work now for your current provider onto our team. We've been on site, we've met with the team members. We're excited about that opportunity. We're also excited about our partnership with the two unions. We have had very positive, very constructive discussions with the unions, and we are very excited about those discussions, how positive they are, and where that is going. We are committed to that partnership. But you do have a number of vacancies. We are going to need to fill some positions. We are hiring. Tell your friends, tell your family to apply. We need to fill some positions. And I wanted to ask Suzanne Moore, our Chief of Operations, to speak to our recruitment and retention effort.
Thank you, Brad. Good morning, everyone. It's such an honor to be here. We really appreciate this opportunity. Certainly to go back to what Brad was saying, our first and foremost goal is to retain the employees that you currently have. We know they understand your facility, your systems. We want to retain that group of employees to be part of the team and to learn, the NAVCare processes and to really create that stability that we can then build to as we fill those vacant positions. So as Brad said, my name is Suzanne Moore. I'm the Chief Operating Officer, but I'm a nurse attorney. I've been with NAVCare about 8 years. And so the nursing side of this is very near and dear to my heart. I understand how nursing staff can be very nervous about a transition. And so we want to be very reassuring to them and, make sure we help them through that transition process. And that's one of our goals. The recruiting department is one of the teams that I manage, and we're really fortunate at NAVCare that we have a recruiting department that's robust. So we have several different recruiters. Each one specializes in a different piece of the recruiting puzzle. So we have recruiters dedicated to just providers. We have recruiters dedicated to leadership. And then we have recruiters dedicated to that staff level of nurses and mental health professionals. So it really helps us identify needs and create a very specific approach to recruiting. Certainly staffing healthcare across the nation is a struggle right now. I think all the hospitals that I've talked to everywhere, are equally struggling. But we're very fortunate at NAVCare because we do have strong resources that make nurses want to come work for us. So one of the benefits of having so much corporate support and so much corporate infrastructure is that nurses really feel like they can just fully engage in patient care. And I think that's one of the reasons we have been so successful in having low turnover. Typically, once nurses come to work for us, they tend to want to stay. And I really think, it is because it's a family-owned company and because we have such strong resources available to them. We do subscribe to a lot of services to help with our recruiting efforts. You'll see at the bottom of the screen some different logos of all the many databases and software services that we utilize to make sure we're accessing as much high quality talent as we can. And certainly that is a big benefit as well. In addition to that, we also provide some really unique benefits that I've not seen matched anywhere in the industry. So we do things like provide all of our employees with free prescriptions. That's just one example of things that we do to just make their lives easier and make sure that they feel valued with us. Again, we really appreciate this opportunity. And Brad, I'll turn it back over to you to wrap up.
Thanks, Suzanne. Well, I just wanted to close again by thanking you and to say, Madam Chair, members of the committee, members of the commission, we're excited about this opportunity. I want to personally ask you for your vote. We'd love to receive that vote of confidence. I am really confident in our ability to do more through this partnership together. So thanks for the opportunity and happy to answer any questions. I'm sure that you have some questions for us.
And Madam Chair, that concludes our presentation. Thank you.
Okay, thank you so much. I have a couple of questions for myself. The MAT protocols that you mentioned, you said that you would, okay, you said that you would have that available for the patients while they're in custody and then also have a mobile unit for after custody. Did I hear that correctly?
Well, no, I may have misled you there. So basically their medication-assisted treatment is an intervention that can help control cravings. And there's a fairly robust record here that tells us that, you know, just behavioral therapies, group therapies alone tend to not be as effective in helping patients with opioid use disorder to recover. And so there are 3 medications that can be used. They are buprenorphine, which takes a couple of different forms. MAT medications tend to be Suboxone, it's probably the medication you've heard. Vivitrol, which is an injectable form of a medication called naltrexone that is a non-opioid and basically blocks the receptors in your brain that if someone goes out and tries to use illegal opioids, they can't get high. And then methadone. And methadone is actually the hardest to manage and to get into the jail environment. So one of the critical things that that we'll do from day one is to continue patients who come into the jail on a MAT therapy. Often patients come into the jail, they've been in a MAT therapy, they've been taking a medication that's keeping them clean, then they come into jail, that's taken away from them, and they're at higher risk when they leave the jail of relapse. So continuing that course of treatment is really important. And then through our discharge planners, we'll be working to help our patients get connected to care when they leave the jail in the community, but we won't be providing any care in the community. We're, you know, our focus is from intake to discharge. That's where we provide the care. Dr. Alvarez can speak with a lot more particularity to that, and then Suzanne Moore can speak a lot more to the operational piece of MAT. But is that responsive?
Yeah, so just so I understand what you just said, if they're already on a MAT protocol, then you will continue that MAT protocol.
That's right. And what we actually envision is over a period of time, it will take us time to ramp up under the contract. We don't envision that full MAT program being in place on day one, but over a 6-month period, ramping up the MAT program. So we're not only continuing patients who are on MAT therapies and then transitioning them to care when they leave, but having the staff and the resources in your jail for patients who come into the jail, they've never been part of a MAT program, of starting them on that course of treatment in the jail, beginning that recovery in the jail, and then transitioning them critically to care in the community. Because if we start helping them with their addiction in the jail and they don't get connected to care in the community when they leave, you can be almost certain that they'll relapse. So through the discharge planning resources that we have, through the additional staffing that we put in the contract, I believe on day one, there'll be a certain level, I'm confident on day one, there'll be a certain level of MAT programming. And within 6 months, we'll have a really robust MAT program that will put you on the cutting edge across the country of those jurisdictions that are investing in caring for patients with opioid use disorder in the jail environment.
Okay, thank you. Suzanne mentioned, Suzanne, correct?
Yes.
Mentioned about staffing. Do you know right now how many staff members you will be needing? And with nurses, as you stated, nurses, there's a shortage across the country. What gives you confidence that you'll be able to address the nursing needs?
Yes, so we do have some information as to the current vacancies. And what we will be doing, starting really immediately over the probably next week, we are going to start posting those positions, and then we'll be sending a team to the site to visit with all the current staff members and really I think as we talk to the current employees about some of the benefits that we offer, a lot of times what we find is they start getting the word out for us, and they know friends and family, and we provide referral bonuses. So a lot of our success comes from really engaging with the current team and helping, them helping us get that word out. But then certainly we will do aggressive marketing and advertising of those positions as well. And, with the goal of hiring almost almost all the positions as possible before go live. In the event we don't have all the positions filled before go live, we'll have some corporate staff members who will, stay and help man those positions until they're fully filled.
Okay. Thank you. I see hands. Commissioner Clark Coleman.
Thank you. Thank you, Madam Chair. First of all, I want to thank you for the presentation. I have to say that I was here initially when this program began, and I had and I was happy to hear that it was running as well as it was. So when I saw this contract, the first question that came to my mind was, if it's doing so well, why are we shifting? Why are we changing? Why aren't we continuing what we're doing? But then as I listened further to Janelle Allen, and I have a great deal of trust in Janelle, when I think it was her that said that the interview panel interviewed the vendors, or yes, and that it was a unanimous decision, that this group was recommended unanimously. So to me, that means that obviously it brings something that we had not been receiving, or we could do better. So I'm okay with this contract.
Thank you, Commissioner.
One last thing, and also the fact that the current employees are going to be interviewed and allowed to stay first before anything else happens. That the current employees will be given a chance to stay if they so wish. That also encouraged me to be supportive. Thank you.
Thank you. Commissioner Baker McCormick.
Thank you, Madam Chair. I wanted to thank you for bringing this instead of to the HHS committee, which I chair, Mr. McLean. Usually it would come to our committee and then we would vote it up or down to move forward. But I'm so glad that the chair and Ms. Allen brought it to the full board so that we can really take a deep dive at this contract, because this means a lot to all of us. So I appreciate that. I just wanted to also ask about the litigation with the Justice Department. What was the settlement, and is there any long-term ramifications?
Sure. So the settlement is public. It's available online on DOJ's website, and basically we paid just under $700,000 to settle the matter with the Department of Justice. I strongly believe that there are no long-term implications, that this is something that is entirely behind us. And we have redoubled our efforts to really monitor everything that's happening across our provider network, and make sure that our team know if the doctors ask you to help with coding, that's not our responsibility. It has to be the doctor that does that. We know it's a burden. We know they don't like it, but the doctor that provides the service has to select that CPT code. And then through our new software system, Quantum Choice, We have a better ability to track what is happening across our network, to look at the coding decisions that our doctors are making, and actually be proactive if we see an individual doctor is consistently billing higher codes, to do our own internal audit, to work with that doctor to make sure that they're always billing the right code for the right service and documenting appropriately. So, I'm confident that we'll continue to be the largest provider of services to the Bureau of Prisons, that through this sweeping investigation, there were only a limited number of instances. Any mistake is one mistake too many, but that we fully resolve those matters and put this behind us.
Thank you. I appreciate you letting us know that up front and, providing that information so that we would be aware and not blindsided by anything in the future. Do you have any diversity inclusion efforts in your upper management team?
We do. We're very committed to equity, diversity, inclusion. As a company, we have a very diverse workforce. There's always more we can do, but that is of importance to us and just part of the fabric of everything we do.
Thank you.
Thank you, Commissioner. Commissioner Khalil?
And unmute. Thank you, Madam Chair. I have a few questions here, and I'm going to start with Commission Counsel, and very much appreciate your analysis, Counsel. All 17 pages of it, very illuminating. Commission Counsel, you raised some questions about the county procurement ordinance and how this either conforms or does not conform to the county procurement ordinance in terms of the company. Well, I won't recharacterize it, I guess, that all purchases need to come before the commission, all procurements. Commission Counsel, where are you at with that right now in terms of how this contract stacks up against our procurement ordinance?
Through the chair, Commissioner, so under this contract, and it actually started with the first vendor for jail medical, many of the contracts related to jail health were transferred from the county to the vendor. And under that meant that the county would no longer directly contract with service providers or, purchase equipment and supplies that would go through the vendor. So the vendor would have the contract with the entity. Therefore, they were not required because there's no provision in the contract that required them to comply with the procurement ordinance. So those were not contracts directly with Wayne County. And so the process used to secure the vendors or the suppliers was up to the vendor. So in this case, it will be up to NapCare as to how they will procure items, whether it's competitively bid or otherwise. It's up to them because they are the contracting party. The county is not. However, because these are services provided to the county, the contract does state that the county has a right to review and approve all procurements. So when asked of the administration if any of those procurements would come to the commission based on the contract and the right in the contract of the county to review and approve, we were told no. And then they referred to the fact that in this instance, these are not direct procurements of goods and services. So the concern here, and that I raised in the analysis, is that the county has a contractual right to review and approve procurements. The CEO under a contract has a right to administer contracts and to implement contracts. However, the county has two branches, the legislative branch and the executive branch. Now, again, the right to review and approve is for the county as a whole. So the CEO does have a right to administer and execute, but we know that under the law, the legislative branch is actually the approving authority, charter, ordinance, whatever. It is the commission that is the approving authority. So the concern is that while a determination could be made by this body that it's not practical to review these particular contracts, my concern is that it's been a unilateral determination by the administration without any specific legal basis to say that they absolutely will not come here. Now, maybe again, practically, this body says we don't want to see him and let the administration do it. But just the notion that that determination has been made to just interpret county in a contract to be only the CEO was just the concern that I raised and I wanted to bring before the body.
And I have a couple other questions for you, Council, but thank you for that. If I can shorten up that discussion, the fact that the contract itself is not in violation of the procurement ordinance, is that correct? It's the interpretation of county is what you are having the most trouble with?
Yeah, I'm not aware of any specific item that occurred that violates the procurement ordinance, though again, our knowledge as staff is limited. So the issue isn't a violation of the procurement ordinance. It's just a matter of procedures and, violation potentially of the charter when you talk about the interpretation of the county and who should do what in what role. Yes.
And that's not the first time that issue has arisen. And I think the commission in approving these things should be well aware that perhaps they're giving up some of their oversight authority. The thing that I am concerned about most is going forward, if we continue with this same kind of interpretation, that this could be applied in other areas where things would just not come before the commission because we run the county day to day. Council, in a similar vein, you talked about terminating the contract. And again, I think we're back into that general word county, where, well, let me ask you directly, Council, can the county executive unilaterally cancel a contract that has been approved by the Wayne County Commission?
I'm gonna answer your question in two parts. I'm gonna first address the issue that's set forth in the analysis, which is very limited. It was regarding specific language about certain county officials making statements that would allow the vendor to actually terminate. So I don't know that the response from the administration was fully addressed what I was trying to convey. But based on where you're going, because the administration in the response indicated that the county could terminate or the administration could terminate. To answer that part of your question, no, they're under the law. This administration does not have the right to unilaterally terminate a contract. Again, the law provides that this body approves matters, and if the administration can simply terminate it, then they're essentially undoing the actions of this body. Again, this particular issue was very limited in scope as far as the language. But to answer your question from a broader perspective, no. But with regards to this contract, termination in general says the county. And so I guess if they ever wanted to terminate, we could have that discussion at that point regarding who is the county. But this agreement specifically just says county. So it's still open, I guess, to some level of interpretation, though I'll tell you that the law is clear.
I gotcha. Yeah, we should probably clean up that if there is that language in other current or future contracts, we should clarify that language and not have to go to the mat if a contract is canceled each time. It should be clear up front. Council, you also raised a bunch of questions on indemnification. Are you satisfied that the proper indemnifications are present in this contract?
Yes, the concern has been fully addressed. There are numerous provisions that talk about indemnification, and I think that the county is properly covered, and I no longer have a concern with that regards.
Yeah, thank you very much, Council. As was referenced earlier, 5 years ago, this commission went through quite a process to privatize Jail Health Service. And it was a difficult process, and a lot of questions came up. And as Mr. Caparu referenced earlier, about a year and a half into that contract, the Auditor General audited the CCS WellPath contract. And I think, given Mr. Caparu's comments earlier, both the commission and the administration were quite pleased with that audit, that it uncovered some things, and the county went in with additional oversight, which I think led, perhaps, Commissioner Baker McCormick, if I put words in your mouth, that all gave us a level of comfort with that contract, that a lot of the difficulties and a lot of the things that came up when we were making the decision originally about privatizing the services seemed to correct a lot of that. So my question here, and I guess, I don't know if it's Commission Counsel or the department or who, will the Auditor General under this contract have full access to the records of, and now NAFCARE in future audits? Will the Auditor General have full access to the records of the of NAFCARE?
Commissioner, I'll take the first response to this, and I don't know if the department or Marcy would like to weigh in. So yes, there is a provision that specifically indicates that the Legislative Auditor General can audit. So that is in this contract. In addition, all of the issues, as mentioned by earlier, with regards to some of the concerns and recommendations the auditor had for this contract and process and procedures are set forth in the agreement. And in fact, our Auditor General, I did ask them to review those provisions to make sure that every aspect of their recommendations were covered, and they were included within the agreement.
And then I guess I'll ask our Auditor General, Ms. Cora, then, do you see any difficulties in getting data from this vendor in future audits?
Marcy Cora, Auditor General. What I did is I took the corrective action plan and the actions the prior contractor was going to implement and compared it to the current contract. And if everything is implemented as stated in the contract, I believe all the risks we had originally identified will be addressed. I also found there was one recommendation in the prior contract, which was real-time recording of the medication. The prior contractor indicated that they could not make that change in their software, but I understand there will be real-time recording of medication distributions in the current contract.
And that audit was outstanding work, Madam Auditor General. But my question is, going forward on this contract that's before the commission now, are you satisfied that if another audit is done 2 years, 3 years, whatever for now, by your office, that you will have full access to the records you need to do the audit under this contract?
Yes, based on what's in the contract. Yes, I do.
Very good. You know, and I do think we learned in that last one, and I'm delighted to, you know, it was the oversight of the contract, you know, that was a main thrust of the Auditor General's audit. And the county did respond to that, and administration did respond to that, and had better oversight, which improved that contract for a while. So we're putting together an advisory board to kind of oversee this contract. It sounds like it hasn't been named yet, but what is that advisory board going to consist of? Who is it going to consist of? And what is their job going to be?
Well, I'll address that. I am proposing that, and the reason being is that the advisory board would also allow internal as well as external stakeholders to participate in that. So one, you certainly have people that are have advocacy around those that are inmates. So we want to make sure that we would have a public body that would be represented. Clearly, also someone from the commission to be represented. Also, those on perhaps behavioral, the DWIN or behavioral health would be represented. Someone perhaps from the courts would be represented. I think it needs to be a very broad stakeholder group to be able to provide input, in addition to looking at our key performance measures and metrics in terms of the administration, not only of medication, but healthcare services itself. And so currently we don't have that. It is important, I believe, that you have external individuals who also can look at policies and procedures to be able to weigh in. We need to make sure that we are actually looking at the national standards for accreditation for any inmates, and also those individuals, of course, who advocate for inmates to be part of this. And so the purpose would be, again, to make sure that we are maintaining all ethical as well as legal, as well as addressing those social determinants of health, that we should be making sure that as people are moving back into the community, that we have provided a level of improving their health outcomes. And also, where possible, that we can also implement programs in terms of helping people with literacy issues as well. And so those things I think are very key to improving not only the quality of life of a person, but more important, to help them transition back into the community.
So under construction, I guess, Director Jordan, is the advisory committee, but that sounds good, because I think that is one thing we learned out of the first contract, and especially in a sensitive area like this with jails it's a sensitive issue in so many different ways in the community, that the more eyes we have on the process, the broader family that we have around this, community family that we have around this, it bodes well, I believe, for the future. A couple of more.
Excuse me, it's to that point, Commissioner.
Certainly, Commissioner.
Go ahead, Commissioner Baker.
I just wanted to clarify, did you say that you would have a inmate on the board?
No, I did not.
Oh, okay. I was just trying to clarify. Although maybe there should be some input from the inmates.
You certainly can have an external, I think perhaps an external, if that would be a decision, and there would be bylaws, of course, of an advisory committee. But if that is something that the internal and external stakeholders would recommend, that certainly is something that I think that certainly should be considered.
Yeah, well, yeah, who better than an inmate to provide input?
To that point, Madam Chair.
To that point, Commissioner Badu.
Our names start with the same B, but to that point, no, you don't have a person that's having surgery to oversee the surgery. You leave that to people that have more expertise. And I could sit here for days and talk about this issue because it is very sensitive. But if I could, Madam Chair, we should maybe be a little bit more laconic and drill down on this just a tad. But thank you.
Thank you. Thank you, Commissioner Basham. And I do see a couple more hands. Commissioner Killeen, let me get to other commissioners and I'll circle back to you.
Don't have the floor?
Pardon?
I don't have the floor?
No, I said if you would mind, I have a couple other hands and I want to have other commissioners weigh in. I can circle back to you, sir.
Okay, please do.
Thank you. Thank you. Commissioner Anderson's had his hand up for a minute. Go ahead, Commissioner Anderson.
Thank you, Madam Chair. I just had a couple of questions real quick. When the investigation of this company was executed by the administration or whomever, or was there someone that did a background check with this company? I guess I would direct that. I know our commission counsel did and found that almost, I think it was about 650,000 or 695,000 almost, that the company did mention that was paid back to the federal government Bureau of Prisons for the Terre Haute prison, but overcharges, I should say. And but I'm just wondering, were there additional things that were found? And was there a background check?
Yes, Ms. Allen and then Mr. McLean.
Yes. Initially, yes, we do have reference checks. We also check litigation history. And we asked that for any respondent. So both respondents had to, I believe it was, had to submit their 10-year litigation history. We also do conduct, as you say, reference checks. But as far as, I'm not sure, it's like if you're talking about an individual and like a criminal background check, no, we don't do something like that, but we absolutely do review their litigation history and related things like that.
Okay. And do they have any current suits against them? Anything pending right now?
Yes, they do. And I see this is a very litigious, I'll say, industry, if you will. And if I recall that from the litigation history submitted, NAVCARE had less than 250 cases, I believe, pending, whereas the other, our incumbent, had almost 600 pending.
Okay.
I can speak a little bit more to that. We currently have around 65 cases. I can't give you the exact number that are currently before a court. The larger number Ms. Allen spoke to was over that was it a 5-year history? There was a larger period of time. And we've never suffered an adverse judgment in any litigation. We've never lost a lawsuit. We do. When we're sued, more than 90% of our cases, our track record is to get those dismissed, typically at the summary judgment stage, and then less than 10% of our cases we do settle. That's kind of been our track record in a nutshell.
I realize that that a company that's in this business is going to have lawsuits. Were most of those lawsuits related to care of prisoners? Is that what they were mostly related to?
That's correct. And the vast majority of the litigation that we have is pro se. It's individuals who are in our jails who are not represented by counsel, who bring actions against us. But we do have some subset of litigation that are cases that are represented by counsel, and some cases that can be employment matters or others. But typically, the cases that we defend involve claims regarding the care provided.
Okay. And to our commission counsel, I think you mentioned earlier that the indemnification to the county is sufficient, you believe, to cover us from any thing that the vendor might be sued for.
Yes, the indemnification provisions are comprehensive and they appear to be sufficient.
Okay. And the last thing I had was, it appeared there was some language in this, the court commission counsel that had found something about the county being responsible for purchasing additional equipment and I believe that, first of all, I guess, is that correct, Felicia? Equipment and supplies and services that they may feel is necessary.
So yes, this sort of may bleed into the conversation, Commissioner, with Commissioner Killeen, which was that under the contract, it's not the county who will be purchasing equipment, supplies, and services, but it will be the vendor. However, the county will own the equipment that would be purchased.
If I could then to Janelle, Janelle, what happens to the equipment? Because I think we did the same thing with a previous vendor. And I believe we bought computers, we bought other types of equipment. Is none of that going to be transferred over to the new vendor, or are they going to just go out and buy all brand new for whatever the differences in the what the vendor might need?
So the county, my understanding is the county does retain ownership, although when you start factoring in depreciation value, we may ultimately decide that we may just get a credit from the vendor. I don't know if our vendor, if Brad, if you've had a chance to assess if there's any equipment that WellPath currently has that you will be able, we'll say, salvage and to use. But until this contract got approved, that I'm sure that'll be part of their assessment.
Okay, that's all I have. I realize the utilization of computer equipment and that can, in a few years, have exceeded its useful life in a lot of cases. But I guess I'm just wondering, we're going to be in the same situation again with the new vendor, I believe, to buy that. But that's all I have right now. Thank you.
Thank you. Commissioner Baydun.
Thank you, Madam Chair. Commissioner Anderson asked a similar question I was going to ask about pending litigation. But thank you for this presentation, Janelle, and the rest of the group. I have a quick question. It was mentioned that they have their own pharmacy where they can buy in big quantities and then in turn pass the savings on to the county. Can someone quantify? I'm just interested in that aspect of the contract. Are we talking about thousands of dollars in savings here?
I can start speaking to that if you'd like.
Yes.
So we've created our pharmacy as a wholesale pharmacy, which gives us the ability to negotiate drug prices directly with the manufacturers. So we've been seeing significant savings over time, and under your contract structure where everything is passed through, you know, every dollar we save will inure to the benefit of Wayne County taxpayers. I don't have robust information on what you're paying now for pharmaceuticals to compare kind of our prices to yours. We could do that analysis for you, but I would expect to see savings. Another aspect of our pharmaceutical services is that you currently, almost all, if not all medications, I understand, currently are being provided patient-specific. That tends to generate a fair amount of waste and increase costs. So we are looking to maximize within the pharmacy laws in the state use of stock medications. So stock medications are far more efficient. They're easier on the nurses, and we can start medications much more quickly if we have all that stock there. We don't have to go through that patient-specific process. So our stock model is really kind of a win-win-win as far as benefit to the patient, ease on the nurses, and cost savings. And we've tended to see a 10% or greater savings when you go from a patient-specific to a stock model. So I would like to see cost savings. I believe we can give you cost savings, but without kind of knowing what you're spending now, I can't compare. Darrell Knight, our chief pharmacist, is with us, and if there are further questions with regard to the pharmacy, she can speak to this better than I can.
Thank you. Yeah, we would be interested in seeing an analysis in terms of what we're paying right now and how much we could be savings, just for comparison purposes. Thank you.
Yes, sir. I'd be happy to provide that.
Thank you, Commissioner. Now let me also thank Council Felicia Johnson, Joe, and Mary. They worked very tirelessly to get answers and questions, and they provided, you know, detailed questions and answers to a lot of things that the commissioners, to make commissioners helpful information. And Janelle, of course, and her team worked tirelessly to get this to us today. Commissioner Killeen.
Thank you, Madam Chair. And just to follow up on Commissioner Baydun's question, it's interesting, Commissioner Baydun, that NAFCARE, with their bulk purchasing of drugs, is doing exactly what the United States of America is specifically barred from doing by law, and that is to buy our drugs in bulk to lower the costs all across the country. Hopefully that bill is going to go through. Was DeWin a part of the evaluation here? Has the Detroit Wayne Integrated Health Network, you know, we've got that nice fat $6 million contract with regards to SUD and a lot of the mental health services. Has DeWin been a part of this process? I know you're looking at when you put together the advisory board, certainly, but what kind of input has the Detroit Wayne Integrated Health Network have in this decision or this proposed contract?
Ms. Allen?
Actually, I'm going to ask if Jennifer Caruso, who was leading the evaluation process, overseeing that.
We are working with DeWin on the $6 million drawdown for mental health encounters. So
Right.
Their IT staff is working with them on that project to get that integration up and running with NAFCARE. We are also, actually later today, we're meeting with Wayne State University individuals to talk about our medication-assisted treatment partnership that also involves DWIN.
Thank you.
Excellent. And also, just want to make sure we can get the department PowerPoint that began this presentation with the summary. The last question I have then is, people that are out on tether, how are they going to get health care? Apparently this contract doesn't cover folks that are out on tether. So what's the county's responsibility for people that are out on tether if this contract doesn't cover them?
This is Ms. Allen. I would have to defer to our attorneys who probably will need to research that issue, because as I know that was one of the questions that commission staff had raised.
Yeah, I didn't see it in our paperwork, but it was a lot of paper in a short period of time. But I would imagine the judges we had earlier, and the more we go down this road of care as opposed to incarceration, that will probably become even a larger issue. That we would perhaps have more people on tether. So I would love to get an answer in terms of, when we put somebody out on tether, what kind of legal responsibilities attached to the county as a result of that action. Thank you, Madam Chair.
Thank you. At this time, are there any other questions from any other commissioners? I don't see any hands. I'm looking, don't see any hands. Okay, is there a motion?
Make a motion to approve, Madam Chair.
Been moved, is there support? Moved by Commissioner Vice Chair Baydoun, supported by Commissioner Clark Coleman. Any further discussion? Hearing none, roll call vote, please.
Commissioner Anderson,
Yes.
Commissioner Basham,
Yes.
Commissioner Clark Coleman,
Yes.
Commissioner Dog,
Yes.
Commissioner Hattis, Commissioner Hattis,
Hey, Heidi, thank you very much.
Oh, you're welcome.
Yes,
I was, I'm on mute.
Thank you. You're so sweet.
Commissioner Colleen,
Aye.
Commissioner Kinlock,
Yes.
Commissioner Knizik,
Yes.
Commissioner Morecki,
Yes.
Commissioner Baker McCormick,
Yes.
Commissioner Scott,
Yes.
Commissioner Varga,
Yes,
Vice Chair Pro Tem Baydoun,
Yes.
Vice Chair Palomero,
Yes.
Chair Bell,
Yes.
motion carries.
Okay, items 2 and 3 will be moved to full board for tomorrow. Next item, please.
Such other matters as may be properly submitted before the committee.
No matters. Next item.
Public comments.
Okay, if you could unmute everyone. If there's anyone on Zoom who wish to make comments at this time?
If I may, this is President Buffington of Local 1659.
Yes, ma'am, go ahead.
I'd like to congratulate you, Alicia Bell, Chair Bell, Honorable Bell, for helping to champion such a great accomplishment in regards to this mental health issue in Wayne County. It was much needed. It is great that I knew that we were partnering as DWIN local employees with the Detroit Police Department, but Wayne County is vast. So I just wanted to give you much accolades in your accomplishments and in joining all of these facilities and all of these entities together on this issue. We thank you so much in Wayne County.
Thank you, President Buffington. That means a lot to hear that from you. So I appreciate that so very much. Any other public comments? Anyone on the line, on the telephone, or on Zoom for public comments? Anyone for public comments? Are there any emails, Madam Clerk?
No emails were received.
The last time for public comments on Zoom or on the telephone. Hearing none, next item, please.
Adjournment.
So moved.
All in favor, say aye.
Aye.
Aye, meeting adjourned. We'll see you all tomorrow. Thank you all so much. Thank you, Janelle Allen. Thank you to the NAFCARE team. We look forward to finally disposing on this on tomorrow. Have a great afternoon, everyone.
Thank you.
Thank you.
Bye.
Thank you.